And AM Extra is watching out for your health this morning. Today is Diabetes Alert Day.
It's a one-day wake-up call focusing on the seriousness of diabetes and understanding your risk. Joining us live with more is Portland-based obesity medicine specialist, Dr. Jeff Stanley. Good morning.
Good morning.
So let's talk about who's most at risk for diabetes, pre-diabetes. What are we seeing among Americans this day and age?
Yeah, so unfortunately, we're seeing just really a skyrocketing incidence of all three of those conditions with folks across the country. And in terms of the risk, the folks that are at highest risk tend to have a family history. So oftentimes we'll have a sibling, parent, close relative that has diabetes, prediabetes, or obesity. We're also seeing that being overweight or having obesity is a major risk factor. And then also certain racial and ethnic groups like Native Americans or African Americans can be at a higher risk.
And type 2 diabetes is definitely the one that we hear about the most. What are some common signs or symptoms of type 2 diabetes?
So interestingly, sometimes diabetes can be sort of a silent onset. So people may have diabetes or prediabetes and not know it for years. But as symptoms develop, the most common ones tend to be things like worsening fatigue. People can have numbness or tingling like of fingers or toes. And then also frequent urination can be a sign of diabetes.
I think, the one thing that's really important for folks to understand in all of this is if they're starting to see some of those signs or symptoms, or if they've been identified as pre-diabetic, there are lots of ways to intervene, right, before it becomes diabetes to a point at which it could be really, really damaging.
Yeah, absolutely. I mean, one of the things that I see in my work and working with patients all across the country is that, diabetes doesn't have to be this sort of inevitable move towards worsening condition and complications, that people can take some steps to improve their health, change their diet, add in more activity, and they can avoid some of those long-term complications.
Well, what happens if you don't treat diabetes, if you don't get out ahead of it and maybe don't get it properly diagnosed even? What can happen?
Yeah, I mean, some of the long-term complications can be really devastating. Again, this can take years to develop, but in many cases, people are at higher risk of heart attacks or stroke. It can lead eventually to blindness or amputations or kidney failure, are some of the sort of main things that I think really jump out as the bad complications.
Yeah, some real serious issues. So what should folks be talking about the next time they see their doctor? Is this something that, you really need to be screening for annually?
Yeah, so this is really part of, an ongoing health maintenance. So, the first thing I would say is, talk to your doctor about what are your risks for diabetes, prediabetes, or obesity. And for those who have a high family history risk, who are dealing with things like obesity, yearly screening can generally be very helpful. For those at lower risk, sometimes the screening is a little bit less often. But what we see most often is that, people may have these concerns, but they haven't been to their doctor for a few years, especially with everything going on with COVID the last few years. Many people haven't had labs. They haven't seen their doctor for a while. So the first step is really getting in, seeing what labs might be necessary, seeing what screening we can do, so you can identify the risk. And then the earlier that you catch it, the easier it is to reverse the condition and, sort of stay away from all those nasty complications.
Yeah, well, some great advice here on this Diabetes Alert Day. Dr. Jeff Stanley, really appreciate you taking the time to join us here on AM Extra to talk about it.
Yeah, really appreciate the time, both of you.
All right, take care.
And for more information about diabetes and how you can prevent and treat it, you can go to the American Diabetes Association. That's diabetes.org.